Okay, so we're going to dive into a topic here. We call this a hard turn in television because there have been many, many states in the US, even local municipalities, that have now declared racism as a as a public health crisis. And so this is something now that maybe is looking at some traction, maybe some steam here in Canada as well. This has caught steam since, especially the killing of George Floyd in Minneapolis. Nate, I'm going to start with you on this one. Declaring racism a public health crisis. Yay or nay on that?
Absolutely. We should. You know, you were teeing up the topic, and mental was a word that slipped out. And if you think about the toll it takes on anybody, you know, I can speak for myself, but people of color, African Americans here in the country and in Canada, around the world, the toll it takes on people mentally. That's why it should be approached that way, just like any other thing that we deal with in this country when it comes to dealing with people's peace. Like, think about the trauma it takes on an individual mentally, and then what it takes on them physically, everything from bumps and bruises to also death, like we see way too often. You know, I oftentimes describe it, and this isn't a way for me to minimize what our troops go through and what they go through when they come back serving their countries. But I do feel like African Americans, we have something that could be described as BTSD, which is Black Traumatic Stress Disorder. And before anybody hears this and say, oh, stop being dramatic. No, just think about it. On a daily basis, the stuff that somebody like me might have to go through, that I have become callous to, whether it's talking to my 16-year-old and 14-year-old son about how they need to wear kid gloves when talking to a cop that might be aggressive because I'm not worried about the ticket, I'm worried about you coming home. Or seeing somebody get beat up on camera or a death, as you see the family and I marching here in my hometown. What we deal with is just like anybody else. I'll quickly end it with this. I was talking to one of my friends who's Caucasian that lives with me, and I said, imagine if your kid was coming home from school and they saw a puppy get hit by a car. Just absolutely horrific for a young child to witness something like that. And that child is part of a family that loves animals, like we all should, right? You would talk to that child and just say, are you okay? Are you okay? And every time there's a puppy, you would be concerned, or every time there was a car accident, you would always be concerned for that child's mental mind space. When it comes to Black people, we see traumatic stuff so often. And most of the time, as of recently, I feel like our voices are being heard, but most of the time it's get over it. It doesn't have anything to do with you. I mean, you weren't a slave, and the white people you live next to weren't slave owners. So why are you so bent out of shape? Because there's trauma that we deal with. And because for so long our voices weren't heard, you just swallow it and move on. So for me, I feel like, yes, it should be approached that way.
Definitely. I fully agree with Nate. I use this term a lot. I call it Black fatigue. That's what I have termed it as. I do not watch any of the videos of any of the trauma that Black people are subjected to. Like the George Floyd video, I decided I was not going to watch it. Anything to deal with police brutality, because it's too much. And it really does affect your mental health every single day, walking through the world in this skin, in this body. You're very aware of it. And I think especially if you have children, for me, becoming a new mom and seeing a lot of the trauma which is inflicted on Black young men, and I have this young Black boy who I am now responsible for in my home, who I love dearly, I cannot deal with it. I just cannot deal with it. And I definitely see how that affects me. Just recently, I had an issue in my building that I live in. And I dealt with some of the staff, and I called it racism. I said, this is definitely a racist act in the way that they dealt with me. And for the time that I had to report it and meet with the manager after, that whole single week, I could barely sleep. I had anxiety about it. And then even when I went in to meet with him, and it was dismissed as, well, are you sure it's racism? I was just like, yes, 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 definitely. But nobody addressed the anxiety of just, even in my own home now, that I have to go through every single day of living in a building where I believe that there's racist staff. And so it affects us every single day. And I don't think we name it. And I think when you also have the intersectionality of being Black, of being female, and then for myself being queer, all of those things add to my mental health and how I move through the world daily.
Well, Brenda on Facebook, she wrote us and said, "Well, I agree that there are many issues to be addressed. To declare racism as a health issue rather than an education issue is a mistake. Police brutality can be dealt with via education in the ranks, and children can be taught to respect all living things rather." And Brenda, I get what you're saying, but disparities in income, housing, medical accessibility, and incarceration rates are all intricately connected to Black Americans dying pretty much a decade younger across the board before white Americans. So it is a public health, not only issue, but crisis. And education is part of it, but we're talking about a country in which half of the population denies that structural racism and white privilege even exist, including the president. So they certainly have their work cut out for them. And this bill that was introduced by a congresswoman on September 3rd in the House of Representatives called the Anti-Racism and Public Health Act. It's the first bill, I'll admit it, it's the first bill I've ever read in my life. And it is a thing of beauty. It is a thing of clarity. And this is not a quick fix. This is not going to be fixed tomorrow. This is something, 5-10 years down the road. But if the act is passed, the data collecting, the primary research, the alternative solutions to sort of figure out what's not working now, and clearly is not working out now, can start.
Yeah.
I love all of that you just said there, Jess. When Brenda respectfully says this is an education problem and not necessarily a health one, then Brenda, I want you to explain why in America, a quarter of the COVID deaths are Black Americans. Meanwhile, they make up just shy of 13% of the population. And while Canada is not currently keeping the same kind of demographics and race-based data as the Americans are, other people who've been looking at this are saying, no, we probably have very similar numbers here in Canada with regards to death rates. And consistently, when I am daily looking at the COVID map of my city alone, it is disproportionately the Black neighborhoods that are getting hit the hardest with the highest number of cases. And so when you intersect racism affects every part of your life. And I don't have to tell this to Trey or to Nate. You can just watch and see that if there is racism, it affects where you live. It affects where your kids go to school. It affects your access to health care. Did you know that in the fine country of Canada, a Black woman is still 4 times more likely to die as a result of birth-related mortality than she is a white woman? That is in the country of Canada. That's Canada. And we are supposed to be the land, the true north, strong and free. So when you talk about racism, I just experienced this with my mother, who is Filipino. She had a health scare and we went to emergency. And sadly, this is not her first health scare. And I've been with her many times to go into emergency. And why do I, as her native English-speaking daughter, insist that I go with her, if I can, to the emergency room? Because she has a heavy Filipino accent, because she is constantly spoken down to. And I'm not going to just blame it and be like, oh, doctors are racist. I'm not saying that. I say that there is such a thing as unconscious bias. And you are more likely, if someone looks like you, or looks like your mother, or looks like your father, or looks like someone in your family, I have seen firsthand the differential treatment. And it so happened that her latest scare in hospital, her emergency room doctor was a young Filipina woman. And she looked at my mother and said, my mother has the exact same problem that I think you have. The care was drastically different. And I'm not saying that the care she received before was worse, but I, as the English-speaking daughter, have constantly spent my life with my immigrant parents correcting, talking, translating for other people. And so I've seen it in that small way. And can you imagine that on a larger scale in every facet of your life? I can't. So yes.